Philanthropist Michael Milken has been studying life-threatening diseases for decades and emphasizing faster cures through his Milken Institute and Foundation. He joins me right now to talk about where we are today in the face of this new pandemic. Michael, it's good to see you this morning. Thanks so much for being here.
Good morning, Maria.
And you just heard all of those CEOs. You and I talked about this over the phone on the weekend, and you said the same thing. You said now is one of those moments in time, similar to after Pearl Harbor, when the country pulled together. There's a new shift in priorities. Tell me about it.
Well, I think we all realize we are all on the same team. We are all pulling together, and we will solve this challenge as we have in the past. My own efforts and those of our various foundations, we have directed all of their efforts here, particularly those in public health and faster cures, etc., to mitigating the responses, and we've been focused in 6 particular areas.
Let's go through those, Mike, because you talk about education, prevention, treatment, cure, and financial. Walk us through what's most important, how we can all get on the same page, and what we need to know in the face of this increasing threat.
Well, we need to make sure focused on education on what we can do to mitigate the cases, reduce the spiking that people are talking about, but also understand that technology, computers are 1,000,000 times faster today. And as we know in cancer, there are more than 15 million Americans living normal lives today, and more than 73 different cancers are linked by similar mutations. This data is available to us, and we have experiences in Taiwan, Singapore, and other countries around the world that gives us a roadmap of what our citizens can do.
Tell me about Go ahead, sir.
As it relates to prevention, we have a lot of discussions, and you've had them this morning, on washing your hands, reducing social interaction. But there's other things we know today because we have sequenced what is called your microbiome, the bacteria in your body. There's good bacteria which can prevent you from getting disease. Focused on diet, what you eat, how you live your life, etc.
You know, you just mentioned diet, and I know that at one point you were given a death sentence. You were told you have prostate cancer, you're going to die, you have a certain amount of months left. You changed your diet, you rallied up the most important and sort of innovative techniques. Tell me what happened real quick on that before we get to the next item, which is I want to go through treatment with you.
Well, what we do know for numerous cancers and other diseases, your diet can change how your genes are expressed and reduce the growth of diseases like cancer. Last year, Jim Allison won a Nobel Prize for this concept that energizing your immune system, quite possibly, and turning it on can put your cancer into remission. In this case, melanoma, which took my father's life in the 1970s and has changed my life and focus forever.
Yeah, wow, incredible. Mike, let me ask you, I want to talk about treatment now. This is another category. What should we be doing? At the same time, we are about to see the number of cases in the U.S. spike. 2 weeks ago, I came on this program. I told the audience, brace yourself. The number is about to go up. And that is exactly what's happening. There are worries that there is going to be a major strain on our healthcare system, Mike, that we don't have enough beds. We don't have enough ventilators, et cetera. What are we going to do with that as you also look at treatment and what's most important for the public to understand?
Well, these 6 areas of education that we talked about, prevention, testing. Testing is going to change dramatically. In Nebraska, they've announced they've got the test down to 2 hours, and I'm sure it will become faster. We can't talk about all the mistakes or what went wrong in the past. We need to focus on how to ramp up testing. And the videos that you showed from the president's press conference on Friday show you, just like Pearl Harbor, private industry and public partnerships are mobilizing today to deal with the testing problem. That will be behind us. Treatment, what is working? We know the Gilead antiviral treatment has already gone into patients. There are more than 30 antiviral treatments that we are testing today. It was not that long ago when the leading talk show host, Oprah, went on television and told Americans that as much as 1 out of 5 Americans might die in the next 3 years. It did not happen. We do not have a vaccine for HIV and AIDS, but antivirals has brought it under control for the vast majority of people in the world today. And so the treatment with antivirals, the treatment with antibodies, and the things that can energize your immune system and put good bacteria in your body are already occurring in cancer and Crohn's disease and have been very effective. So everyone is concerned that how long is it going to take. There is a high probability that we will control this disease with antivirals and other treatment long before we have a vaccine.
I see, because they're talking about a year with a cure, a year for a vaccine. Based on what you know and have studied in terms of medical research, you think just the antivirals, the therapeutics, could actually be quite significant even if we don't have a vaccine for a year. Let me ask you about financial, because obviously sports is shut down, concerts are shut down, people are not spending money, you're not allowed to be in big crowds. What is the answer here? You heard some of the stimulus that we've talked about this morning, Congressman McCarthy, Peter Navarro talking about a fiscal stimulus. What to do about the U.S. economy slowing down as much as it is and possibly going into recession mid-year?
Well, that is the 6th area that we're focused on. Once again, education, prevention, treatment, care, how we're caring for people, and cure. And then financial. The majority of Americans, the vast majority of Americans, live paycheck to paycheck. We have to keep this feeling of economic freedom for them and their families. And likewise, more than 50% of all the employees in our country work for small and medium businesses, those small entrepreneurs that have reached out and created a business. And so I think there's a number of things we can do, and we are extremely focused on this area as to how we can bring freedom. There are new companies in America today, digital companies, that loan money to people to cover paycheck to paycheck, charging no interest. They've interacted with tens of millions of Americans and have the ability to distribute money to them. So we have solved these problems with polio, with AIDS and HIV, and we have made enormous progress in cancer, and cancer drugs that we have might be the solution here. But we have to stop starting and building a healthcare system and then dismantling. We have to keep this in place so that every time this isn't an emergency.
Yeah, absolutely. Mike, it's great to have you this morning.